Dr. Louise Newson. Hello,
Hi.
how are you? Welcome to the podcast.
Oh, well, thanks for inviting me. I've been looking forward to this for a while.
I'm very excited. I appreciate you taking the time. What time is it where you are right now?
9:30 p.m.
So
So it's
that's
not too late.
9:30.
Yeah,
9:30.
yeah.
Okay, got it. Every time I have obviously a bunch of friends and colleagues in the UK, and every time they say half nine, I'm like, does that mean 8:30 or not? Got it. Okay,
Yeah.
amazing. Um, so I'm very excited. I just to start off before we dive deep into the all the meat and potatoes of everything. Who are you? Can you just tell everyone who you are and what you do?
So I'm Louise Newson. I'm a physician, but I'm specialised in female hormones. But I've got an unusual background in that I've got a pathology degree. So that's the study of disease. So I've got a degree in that and a degree in medicine. And I spent a lot of time in hospital medicine doing different specialties, and then was a GP, a family physician for 25 years. And now all I do is think about hormones. So I do quite a lot in the public domain. I do a weekly podcast. I've written a few books, and I run a very large clinic actually, which just sees women who are underserved by our National Health Service over here. And actually, a lot of people come from abroad because they're underserved over from abroad as well. So my mission is to just improve the global health of women. That's all. I aim quite high.
I love that. It's simple and it's unbelievably important. I love it.
For sure.
So when I announced that you were coming on my podcast, many people were incredibly excited and they love your work. And I got messages from people, and I've seen them in your comments, like on every post of yours.
Mm,
I see women saying, "You've saved my life," like
I
literally. And
know.
we'll talk more about that, but literally, you saved my life. And also, there were a handful of people who were like, "Oh, she's very controversial. She's
Mm,
very controversial," which,
mm,
for whatever it's worth, people say that about me as well. So I'm not
mm.
concerned about that. What makes you controversial?
Do you know what? I think it's because I wear my heart on my sleeve, and I don't have a hidden agenda. I don't work. I'm very proud. I do no paid work with pharmaceutical companies at all. I don't endorse any products. So people find that a bit scary because I can say
Mm,
exactly what I want, and my work comes from evidence and clinical knowledge because the two go hand in hand really when you're a doctor. Um, so I think actually when someone called me controversial recently, I said, hang on a minute, why don't you call me a thought leader? Why don't you call me a pioneer? Why don't you call me someone who's clever? Why is it controversial that I'm pushing the agenda forward in a quicker way for women than perhaps others have done? So
mm.
I just think it's a use of words, really. And it's interesting, a lot of people who don't like me or think I'm controversial, they'll never tell me to my face, you know.
That's 100% exactly right. They would never come up to you and say that. Online, they're more than happy to, but in person, they wouldn't do it.
Yeah. So I sort of get upset, but then I get more upset for the women that are suffering and the women that would suffer more if I stop my work. And I've got three
Hmm.
daughters, and my middle daughter's quite feisty. She takes after me. I'm a middle child as well. But she keeps saying, "You get back out there. You think about the women you're helping. You ignore the haters, and you just keep
Yeah,
going." And,
yeah.
when you put yourself in the public domain, as you know, you're not going to keep everyone happy. But I'm not here to keep everyone happy. I'm here to help the women that are suffering and not being listened to and allow them to have information so they can make the right choices for them.
I love that. How old are your daughters?
So they're 22, nearly 21, and 14.
That's amazing. That's
Mm,
amazing. I've got two daughters so far. I have almost 3-year-old and an almost 1-year-old.
nice.
So very
Oh,
different places, but I'm obsessed with my girls, and
yeah.
it's wonderful to have someone like you. Obviously, my daughters are very far away from anywhere near being in menopause, perimenopause, but it is wonderful to have someone like you to use as a resource and just to learn from in regard to all things hormones and female health. So I really appreciate it.
Oh, thank you.
So just to give some context to everyone listening, the whole reason that we're here is actually because I recently made a post on social media, and I'm gonna read the post and then just give people context as to how we ended up here together
Yeah,
right now.
yeah.
So the post that I wrote, it said this: I've never had a menstrual cycle. I'll never go through menopause. I'll never personally know what it feels like to experience any of that. I have, however, studied it for many years, and the overwhelming majority of my clients are women ranging from teenagers all the way to 80 plus years old. With that in mind, it appears to me as though the quote unquote menopause industry is becoming a multi-billion-dollar industry built on the foundation of telling women that they are weak and fragile and they can't work out hard and their bodies are broken. Going through menopause absolutely creates a new set of difficulties and challenges. But you're only weak and fragile if you believe you're weak and fragile. You aren't broken. You aren't delicate. Train hard, get strong, and don't believe anyone who says you can't. Now, you shared this post, and you said 3 things. You said, number 1, everyone should understand menopause considering it affects half the population. Amen. Thank you for saying that. Completely agree. I think everyone, men and women, should all be learning about it. I think we should learn about it in school, to be honest with you.
Yeah.
Number 2, you said Syatt Fitness understands menopause more than most doctors, which I can't claim that, but I sincerely appreciate the kind words. And then number 3, and this is something I think is really important, and I want to hit on it, but early on, you said in your research, you found that 79% of menopausal women reduced or stopped their exercise. Why are we seeing such a dramatic drop-off in menopausal women exercising, and what do we need to do to fix this?
Yeah. It's so important, and thank you for bringing it up. I forgot that I put those three. I must have been feeling very, very right on that night. But I just thought it was brilliant. I love meeting people who I wouldn't expect to be talking about hormones, but it's really important because a lot of people. I met someone recently. Actually, I was doing an event in Oxford for the Longevity Project, and someone said to me, "Gosh, Louise, it's really nice to meet you. I thought all you did was prescribe hormones." Like, what? Yeah, I take hormones, but I tell you what, if I did no exercise and ate rubbish, I wouldn't be strong. And I still exercise. I do a lot of yoga, and it's really important. So obviously being holistic is so important. And I don't need to tell your audience how important exercise is. But I tell you what, I like to be active rather than really sporty. I sort of, exercise is important to me, but I'm not obsessed with it, if that makes sense, just because I'm busy and I like sitting and working rather than working out. But it's important. And I found yoga about 20 years ago, and I do it most mornings, and I do a headstand, which is a good thing because not
Let's
many people
go.
can do
That's
headstands.
awesome.
Yeah,
That's
so
amazing.
it's like a bit of a kick-ass thing, really. But when I was perimenopausal, so when my hormones started changing about 10 years ago, I found it really hard to exercise. And I'm speaking on behalf of being a woman, but this is echoes in lots of people I speak to. So I couldn't be bothered. I couldn't be bothered to do anything. I was really exhausted. It's like trying to wade through treacle. So I had this amazing lethargy that I only had when I was pregnant, but I knew I wasn't pregnant. So that's one reason why I didn't exercise. The other reason is that I felt really miserable and I felt very low in myself and reduced self-worth. So it's like, do you know what? I hate myself. I hate life. I hate everything. What's the point? So there's that going through my mind. Then I'm getting really bad muscle and joint pain. Like my joints, I felt like the Tin Man from Wizard of Oz. Everything was stiff. And if any of you do yoga, you have to flow it's like every day's practice is different. But I just felt like I wasn't flowing. My vinyasas were really stiff and wooden. And I'm like, God, I've got no strength. Like, what am I doing? This is really unenjoyable. So that's going on. And then I was getting a lot of migraines as well. And I have migraines frequently, probably 2 or 3 a month, but this was like almost back to back. Like, how can you exercise when your head feels like it's going to explode?
No,
you can't. And then everything is an effort. So the last thing I wanted to do was exercise. And I see it time and time again, and I know how important it is to exercise. I didn't need someone else telling me, you need to exercise. I know that, but I just couldn't do it. And you also, I'm sure, realise the less you exercise, the less you want to, and the harder it is. So you've got this vicious cycle going on as well. And then you think, well, I'll go to bed early and I'll sleep one and I'll do it tomorrow. You go to bed and you're waking up 3-4 times in the night and you're having these awful thoughts about your children are going to be harmed on the way to school and you're not going to be able to pack the school bag, and then you forget their music lesson, and they've got a, and you're just like, God, I'm such a bad mother, and now I'm a bad doctor because I can't remember the drugs I'm supposed to be prescribing, and I'm not a good husband. My husband's like going to leave me, and you just catastrophize. And I'm sort of saying all this because it happened to me, but it happens to millions of women all the time. And so when you're talking about menopause being a multi-billion-dollar industry, it is, because people are trying to sell us things that will make us feel better. But it took me about 6 months to realize what was going on. I gaslit myself because I thought, well, I've got 3 children and I'm working hard and I'm caring for my cats and my husband, and maybe I'm not cut out for this. I'm 45. I was then. So I thought, I can't go to a doctor because they won't take me seriously. They'll just think I'm a bit pathetic. So even me, and I was then doing my clinic and I was developing my website, and I was trying to work in the evening, but I kept saying to my husband, I can't, my brain doesn't work. But I was writing about people feel tired, people have joint pain, people have migraines. So all these things that were happening to me and I hadn't realized. So it was only after about 6 months that I had a light bulb moment, just because I was shouting at my middle daughter because she wasn't going to bed. And she was like, Mummy, you're just so argumentative. You just shout so much. What's going on? Do you need a period? That might improve your mood. And I'm like, oh my God, I haven't had a period for months. And then I realized. So I was very
How old were you?
I was 45. So I'm the average perimenopausal woman. And I just didn't join the dots. And that's why I developed the balance app that I've created, so other women can hopefully suffer less than I did. But then I'm like, they're going, right, I know I can't go to my GP, my family physician, because my friends are coming out with antidepressants and I know I'm not depressed. Like, how do I get HRT? What do I do? How do I get it? So, and now I'm very fortunate because I've got the right dose and type and testosterone's made the biggest difference to me mentally and physically. And we've just published some research showing that as well. And we can talk about that in a bit, but it's really interesting because for many years, and even now, if you Google menopause, it will say flushes and sweats. Like, what about not being able to exercise? What about not being able to lift your head off the sofa? What about feeling really dark in your mood? All these things are really important. So, and I think the women who carry on exercising despite having all these symptoms deserve more than a gold medal, because if you feel like that, it's really difficult. But, I'm fortunate when I'm on hormones, I exercise a lot easier. I've started doing some weights as well. And I just know that I'm stronger than I was in my 40s because I've got hormones that are stimulating my muscles and helping reduce the sarcopenia, the muscle loss that we get when we're older. And, exercise is an investment for our future health, isn't it? Like, it's so important. And I look at older people that haven't exercised, and I want to be independent. I want to not have to use a Zimmer frame, and if I do, I want to use it independently. I want to reach the cupboards to get my food out when I'm older, and I want to get out of the bath without having to get my husband to haul me out when I'm in my 80s. It's those things that we don't see when we're younger because we just think we're invincible and we're always going to be fit and active. But it really hits home when you can't do it, when you want to and you can't, and you're physically in pain. It's a real wake-up call, but it's not enough just to exercise and think that's enough if you don't have those hormones.
You brought up such an important point that if you Google search menopause or any of this, you're going to get hot flashes and all like these standard symptoms. But what you brought up is so important from the perspective, and you've said this many times, that 1 in 10 perimenopausal women experience suicidal thoughts. And research has shown that women aged 45 to 54 have the highest rates of suicide among females, which not coincidentally lines up with perimenopause and menopause. What is happening here, and how do we fix this, and how do we help people become more aware of these? It's not just hot flashes. That's such a diminishment and a spit in the face of what people are actually going through, what we as women are going through.
And thank you for bringing it up, because there's a lot of misunderstanding out there. And in fact, some of my detractors, if you like, who are doctors as well, keep saying that I'm scaring women about menopause because I talk about suicide. Now, not every suicide is linked to hormones, and not every woman will be suicidal. In our clinic, we found that 1 in 6 women have suicidal thoughts the weeks before they come to the clinic. You say like 1 in 10 general. That's a heck of a lot of people.
It's a lot.
It's a
It's a fuck
huge
ton of
amount.
people.
So most of us know 10 people, right? So one of them, and chance might be, have these dark thoughts. And so I'd make no apologies for talking about it, and I'm sorry to like be so depressing, but I'm shocked with the thousands of women I see regularly through my clinic who have these thoughts, and they've been under psychiatrists, and no one's thought about their hormones. But my work isn't just menopause, actually, because I'm really interested, like I say, in women's hormones. So there's a lot of women with premenstrual syndrome or premenstrual dysphoric disorder, which is the more severe form, and they have very intrusive dark thoughts. Actually, can be worse for them, but it's only for 3 or 4 days a month, which you think, oh, that's okay. It's only a few days, but it's not okay because the rest of the month they're worried about those days coming. So a lot of people who are younger will still have these dark thoughts, or postnatal depression is a very common cause for suicide. And what's happening is we have to be thinking about these hormones, not just something that affects our periods, because that's been the big problem, I think, in what we talk about menopause, because menopause by definition is a year since your period. So you're constantly thinking, or you, but we're all constantly thinking about our wombs. Like, even as a woman, I'm not bothered about my womb. I'm bothered about my brain, okay? And, you know, my brain is more important than my womb, and I think others would agree with that. But the hormones, estrogen or estradiol is the most active, best form. So estradiol, progesterone, testosterone, yes, they're made in our ovaries, but they're also made in our brain. So anything that's made in an organ means that it's useful for that organ, that it has a function. It's not there for a bit of a laugh. It's there because it's really important. And our brain is just the most amazing organ, but it needs different chemicals to work, to fire all these nerves, to tell our brain what to do and how to function, and to grow the nerves, to grow these neural pathways, if you like, and to grow the cells as well. But those hormones are important for all of those processes to occur. And if they're not there, the hormones, or worse, actually, if they're fluctuating, it can trigger chaos in the brain. And so a lot of people who have mental health issues, it can be worse during the perimenopause, so before the periods stop, because the hormone levels are changing. And that's the same with PMS and PMDD and postnatal depression. You get a big drop of those hormones in the brain. And some women's brains are very sensitive to those changing hormone levels. And it can trigger a lot of reactions. So people can be very sad, very joyless, but they can also be very irritable, very angry, you know, but also it can affect other metabolic processes in the body, because every area in our brain has different jobs. So we have pathways to our liver, so our metabolism can change because we've got changes in our nervous system in our brain. Our heart rate, our respiratory rate, that can all change. The way that our coordination, so a lot of people get quite clumsy, and that's because the cerebellum, the part of the brain that helps with coordination and movements, will be affected as well. So we need to be thinking about what's going on in our brains, as opposed to, oh, it's just our periods and we might get a hot flush and then we'll get through it and then we'll be fine, because it's not. And, you know, it's easier in the UK and US for women who have hormonal changes to be prescribed antidepressants than it is hormones. And that's just wrong.
Yeah, it's insulting at the very least,
Yeah.
right? I would imagine it's like you just
insulting.
on this antidepressant.
Yeah,
like
it's insulting, but more than that, like in medicine, as a doctor, I'm always taught treat the underlying cause. Try and find what the cause of the problem is, and then you can treat it rather than just putting a sticky plaster on it. So if someone has got an underactive thyroid gland, I wouldn't tell them to go and eat more meat and do more exercise. I would say take some thyroxine. And by the way,
Right.
you might need to eat some meat and exercise, but, you know, let's replace your hormones. If someone's got low iron, you would then work out with them, well, how do you get more iron into your diet, or do you need a supplement? So if someone is really tired and got reduced stamina, not sleeping well, headaches, joint pains, and they've got really low testosterone, what do I do? Do I say, oh, just go and take a shower and you'll, do some chanting in the woods and you'll be fine? Like, no, but everyone seems scared of these hormones. And it's because people don't understand them and they think they're just about controlling a woman's womb. And that's where thinking differently is really important to help women. But you're right, it's the mental health bit. That's the bit that, well, it doesn't really keep me awake at night because I need my sleep, but it's the bit that worries me because we see it and we hear it. And I've met lots of partners who's lost their partners by suicide. And they give a very clear story about how hormones have changed in them, and women who have been close to ending their lives. We saw someone recently in the clinic and she'd already written her suicide note. She came as a last resort because no other doctor could help her. And thankfully she's fine, and she can't believe that the hormones we gave her are illegal because she said, I haven't felt this good in 20 years. But then she started crying and said, but if I knew about this, I wouldn't have made the decision to never have had children because I was so scared I would never watch my children grow up. I would have had a different relationship. I'd have a different
Oh,
career.
geez.
And like, this is what I hear all the time. And it almost becomes normal because I've heard so many stories, but it's not, and it can't be normalized. And this suffering is just horrendous when we've got very cheap, effective treatment. And I'm not saying that everyone's going to feel better on hormones, but I tell you what, a lot of people do. And I see a lot of women who are my children's age, so like women in their early 20s, and they're already getting really dark, really negative thoughts those few days before their periods. And then they can't exercise because they feel more tired, and they're told, oh no, download this app and it will tell you just do some like heavy breathing or Pilates and then do your high intensity training after your periods when you've got better hormones. Well, no, actually, if I give you just a few hormones on those few days where you're feeling bad just to top up, you're going to feel better. And these women, I say girls because they're in their 20s, but these women will come back and go, wow, I didn't realize I could feel this good every day of my cycle.
And it's important because obviously the suicide is the extreme, but it's not, obviously we want to prevent that as much as possible, but also we want to improve your life. Like, even if you're not suicidal, like, how about we just make your life more enjoyable, healthier, give you the ability and the opportunity to exercise, to feel better, have better relationships. If you want to have children, have that opportunity. Like, it's
totally agree. And I'm not from a medical background, so no one in my family has ever been a doctor. And I decided at an early age I wanted to become a doctor. And I was one of those, I want to just make people feel better. Like when I was 3, 4, I'd make my dad dress up as a nurse and I would be the doctor. It was very much like just to feel better. And then I've led some adverts that they're advertising Premarin, which is an old-fashioned, if you like, type of HRT. And they've got these women and it's from the 50s and they're saying your well-being will improve. Well, that's fine. That's absolutely fine to have a treatment that's safe and improves your well-being. And if that's all it did, I just don't think that's a bad thing. But we know that hormones do far more than that for our future health. But it's almost like it's a bad thing that we help women feel better. And if
it's wild.
I can't get it. Like I don't understand when doctors like globally are really resistant to women having hormones. And I'm very open to my patients. I'll say, like, I don't know whether this is going to help you or not, but we can try it. And if it doesn't, you're in control. You can stop it. But usually they go, wow, I feel so much better because it's helping their brain. So they can't even get there. They've just been saying, no, I've been given 5 different antidepressants and now I'm on an antipsychotic and they're about to start lithium. And then there's a big advert today about this new ketamine clinic that's opening in Scotland. And I see so many women who've had ketamine infusions for their inverted commas treatment-resistant depression. And it's like, hang on.
Oh my goodness.
You've had this depression that's came on in your mid-40s and you've always had some PMS. Perhaps it's your hormones, So and I'm sure ketamine, I've never had it, but I'm sure it I'm sure it makes you feel great, but it's not going to replace your missing hormones.
I want to come back to HRT in a moment. you've said something that has really shifted my perspective. I'd imagine millions others as well. You said menopause should be seen as a potential long-term hormone deficiency with health risks rather than just a natural transition
Mm,
for women to
mm,
endure. Um, I've noticed menopause is often reduced to the end of having periods, right? It's like periods
mm.
over and menopause. Could you just explain biologically what's happening in a woman's body during perimenopause and menopause, particularly with the hormone fluctuations and their systemic effects?
Yeah, and so what happens in general, because everyone's different, is that our hormones are made, like I say, in our ovaries, but elsewhere as well. But in our ovaries, we're born with a finite number of eggs. So once the number of eggs reduce and go down, the hormones associated with the egg production and the way the eggs are released, when we ovulate, go they change as well. So when the hormones reach low enough levels, we're not going to have our periods, and then it's end of our fertile lives, if you like. But this is important, that it's very different now to how it was 100 years ago, because generally the average age of menopause is around 50. Some countries it's mid 40s, even early 40s. But if you think back to the Victorian times, we'd be pregnant a lot more times. We'd often have about 15 pregnancies. We wouldn't all carry them to full term, but people would often have 6, 7, 8 children, wouldn't they? So we'd have a lot of hormones in our body when we're pregnant. We're not ovulating, releasing an egg when we're pregnant, of course. So then we would actually have a menopause often in our mid to late 50s. It would be later in life because we'd have more eggs around, obviously, because we weren't using them when we were pregnant. But we're also living longer. Our life expectancy is so much longer. In the Victorian times, we used to die a few years after our menopause. Whereas now, often, if you think the average age is 50 or 51 or whatever, most of us, hopefully, but women generally live until their 80s. So we've got 30 years without our hormones. But also now we know that it's around 1 in 30 women under the age of 40 will have an early menopause. And sometimes that's just bad luck. It might run in families. It might be that they've had their ovaries removed for a disease like endometriosis, or they might have had cysts or whatever. Or they might have had a cancer treatment which affected the way their ovaries work. They might have had chemotherapy or radiotherapy. And other autoimmune diseases can affect the way the ovaries work. So for those women, if they become menopausal in their 30s, they might have 50 years without their hormones. And so if we think about what these hormones do, and hormones is just a word for a chemical messenger that goes in our bloodstream and affects every cell in our body. But the 3 hormones, estradiol, progesterone, testosterone, affect every cell in our body. So of course they regulate our periods, but when they go in their blood, I've already said they go in the brain, they go in the muscles, they go in the joints, they go in the bones, they go in our heart system, they go in our bowel, they go in our skin, like they go every single cell. But they're there for a reason. They're there to keep our cells functioning and to keep us healthy and reduce inflammation in our body. So suddenly, if we don't have them, of course we can function, but our cells aren't going to function as well. We have more inflammation in our body. We become more pro-inflammatory. And we can try and reduce this inflammation by exercise and diet and well-being and everything else, but we've still got it slightly turned up a bit. And that's why we know, and we've known for decades, that women, when they're menopausal with low hormones, have an increased risk of inflammatory diseases. And these diseases of inflammation are the diseases that are killing women. So heart disease, osteoporosis, diabetes, dementia, cancers, autoimmune diseases, non-alcoholic fatty liver disease, Parkinson's disease. These are all inflammatory diseases. And we know that the longer a woman is without her hormones, the greater the risk. We've known that for a long time. And that's why it's important to think about it long term. But the way sometimes it's portrayed is that it's just a transition. And you could say it's a transition because women are changing to accommodate these low hormones, but they're still going to have this inflammation in their body. And I think that's where educating women to know that that's happening, especially as we know, on average, the last 10 years of a woman's life is often in poor health. And it's really important, this whole lifespan, health span thing. Like, I don't care the age that I die, but I just want it a good journey to that age. I don't want to be cooped up in a care home, like rocking and, with osteoporosis of my spine. And so it's about, this is where the choice thing comes in. I'm really worried personally as a menopausal woman about osteoporosis. I've just seen so many women with osteoporosis of their spine that are in so much pain. So of course that's why I exercise and look at calcium in my diet. But when I was perimenopausal, I lost on average 16% of my bone density, because our hormones are really important for bone strength.
You did? You lost 16%?
Well, that's what people do on average. I didn't test it, but on
Holy
average
shit.
in perimenopause. So you don't wait till you're menopausal. This is where we have to be thinking about these hormone changes.
That's insane.
It's a huge amount, isn't it? It's massive.
That's petrifying.
It is petrifying. And also, osteoporosis, like, so if I was diagnosed with breast cancer tomorrow, or I was diagnosed with an osteoporotic hip fracture, and I said to you, oh, guess what? I've got breast cancer, or guess what? I've had a hip fracture. Which would you give me more sympathy for?
Unfortunately, I know the right answer here. Unfortunately, it would be the breast cancer, even though realistically you're more likely to die from the hip fracture.
Yeah, so 1 out of 5 women will die in that first year after an osteoporotic hip fracture. Like, that's a high mortality. Like, that's worse than a heart attack. That's worse than most cancers. But no one will really give me much sympathy because it's an old woman's, and this is where we've got to wake up and think about what we're doing to women by not allowing them to have a treatment that will strengthen bones.
They don't comprehend how serious osteoporosis, like they don't get it. It's devastating.
Yeah. It can be, and and this is where I feel like we've just been so scared of hormones that we've ignored them. And when I say we, it's like women, it's healthcare professionals, everybody is scared because of misinformation. But rather than going, hang on, why are we scared of our own hormones? What's going on? They've just happy to do that and then medicate us with other medicines for all our different symptoms and all our other diseases that we get. And that's why I feel it's like a complete injustice to women, really. It doesn't feel fair.
Okay, so let's talk HRT. So it's obviously a cornerstone of your practice, and I've learned a lot about it from you.
Good.
Obviously, debates still persist about its safety, notably in regard to breast cancer. And this was, as you saw, I put up a question box in my Instagram, and this was by far the most common question around breast cancer risk. But what is the current evidence on HRT's benefits versus risks, especially for long-term use?
It's great that you're asking. So firstly, we need to define what HRT is, because I think this is really important and it's a crux of everything. So it's only 3 letters, hormone replacement therapy, but I don't even like that. I mean, I'm so negative, aren't I? I don't like the word menopause. But hormone, like, there's hundreds of hormones in our body, so that's not even telling me what hormone it is. Replacement, actually, I've already said, if I give hormones to women with PMS, I'm just topping up their hormones, so I'm not replacing. And then therapy sounds like I need to be at a couch in my room and it's some talking treatment, so it's just wrong. What we should really be talking about, what is it we're giving? Is it estradiol, or is it another form of estrogen? Is it progesterone or another form of progesterone? Or is it testosterone or a different form of testosterone? And that's really, really important. So instead of thinking about menopause being a hormone deficiency, we should be thinking about, have I got estradiol deficiency or progesterone deficiency or testosterone deficiency, or all 3? Because some women might only have progesterone deficiency. If they've got PMS, they might just need a bit of progesterone. There's a lot of women who have low testosterone before their estradiol and progesterone lowers. So anyway, if we think about HRT, what it is now to what it was in the past, it's very, very different. And this is really important when we talk about risks. So when I prescribe hormones now, I prescribe exactly the same chemical structure as the hormones I produced when I was younger. So those chemistry diagrams where they've got like rings and oxygen and hydrogen, it's exactly the same as that. It's derived from soy and yam plants. yes, it's been manufactured, but most things we have been
Correct.
manufactured. So
Correct. Yeah.
that's no big deal. But it's exactly the same. So we've got the receptors on our cells. It's like a lock and key that they recognize that key coming in, unlock, all these lovely biological actions occur. Now, when we talk about HRT and any risk, that HRT is all synthetic. It's been chemically modified. So there are two ways they made the estrogen different. One is something called ethinyl estradiol, where they added an ethinyl sort of part so it doesn't fit the receptor quite well. And that's in all contraception, by the way. So it doesn't fit well and it has risks associated with it. But the other type of estrogen that they used to make HRT from was pregnant horses' urine, because they wanted to commercialize and make it in big volumes. And so they used pregnant horses. Now, pregnant horses' urine, of course, contains estradiol, the natural estrogen, but it also, as you can probably guess, contains all sorts of other hormones as well. And God knows what else. So you cannot compare.
I just want to know the meeting that they were in when they're like, "Here's what we're gonna do, team." Like
Well, it's very interesting, because when you look at the history, they realised that women had who were pregnant had hormones in their urine, and the first HRT was made from pregnant women, but their volumes they needed was so big. And the same with testosterone. They used to go in the streets in the 40s.
Stop.
And they used to get it from prisoners. So they used to have like
Shut
thousands
up.
of liters. No, I'm true. You can look it up. They had thousands of liters of urine from prisoners to try and make testosterone for men. And then they realized they're never going to make enough money. Like, how the hell do you keep this up? It's just madness, isn't it?
That's crazy. I did not know that.
Yeah. So that's important. But then the progesterone is actually even more important, because the progesterone that's in all contraceptives, actually, but also in the older types of HRT, has been synthetically altered. So it doesn't have the same structure. And the one they used in the study which showed this breast cancer risk was something called medroxyprogesterone acetate, which is not a very nice progesterone. They used to inject it in prisoners to stop them having a libido. Like, it's
really?
Yeah. It's not a very nice drug. But they gave
it was like a castrating.
Yeah.
It was like,
yeah.
jeez.
So, I know. Honestly, it's the more you delve into this, the more you're like, oh my goodness. But let's keep focused. So you've got pregnant horses' urine of the estrogen. You've got this synthetic progesterone, and they found, like, quite soon after hormones were discovered, that women were so much healthier when they had hormones of whatever they had. They had better bones, they had better heart system, they felt better, all these, they had less depression, they were less in asylums, all these things. So they were like, right, let's try and give it to older women to see if we can help their future health. And this big study had $1 billion on it. Like, I don't know any other study where they've spent $1 billion on women. I was
going to say, are you serious?
Yeah,
$1 billion?
Like, and this is in the 90s it started. Like, what the hell? Like, it's amazing. But it wasn't amazing because they had to give the HRT to women without symptoms, because most of us have such awful symptoms that melt away with hormones. It's so obvious who has placebo and who doesn't. So they said, let's find a cohort of women that don't have symptoms, so it won't be so obvious because we're giving the HRT for health benefits, not for symptom benefits. So the average age in this study in the women was 64. So they were starting HRT in their 60s. A lot of those women were overweight and they'd had heart attacks. And they were given this synthetic type of HRT. Now, we know one of the risks of these synthetic hormones is an increased risk of clot and heart attacks. Only small risk, but that risk increases as we get older. But they started to do the study. And when you really delve into it, they were worried about the money that was being spent and they were worried about what was going on. Then they thought, oh, there might be a little wiggle over the line of breast cancer. Let's pull the study. So usually if you do a study or stop a study, you analyze the data really carefully before you put it out. But what did they do? They just went straight to the press and to the lay press and the medical press and said, HRT causes breast cancer. HRT causes heart attacks.
Oh, geez.
Stop HRT. And I've listened to like the news from the US where they've got people announcing it. And they're like, this is terrible. So HRT prescribing fell off a cliff, understandably, because everyone's going, oh my God, this is awful. But then they did do the sensible thing and analyze the data properly. And we've now got, years of data. But if you look at the data, there's a couple of things that are really relevant. One is that when women only had the pregnant horse's urine because they'd had a hysterectomy, they didn't need the progesterone in the same way. When they followed those women up, they had a 22% lower risk of breast cancer. So the estrogen is not the bad thing. That was one thing, but they didn't make a press release about that. That just got written up in a scientific journal that's collecting dust somewhere in a library. But that's fact. But then they saw the methoxyprogesterone acetate group with the synthetic estrogen, and they had a slightly increased risk of breast cancer, but it wasn't statistically significant. So it might have just been a chance effect. So we've known that there might be a small risk, but the risk is really low. And let's look at other risk factors for breast cancer, like not exercising or drinking alcohol or whatever. That's higher than HRT. The breast cancer risk is one thing. The heart attack risk, we know because it's synthetic. But let's look now. When I say we give hormones, we're giving the natural hormones. There's never been a study that shows that natural hormones are associated with cancer. And why would we have something in our bodies that causes cancer? It just doesn't make sense, does it? Of course, it's not. They're very anti-inflammatory. But people are getting very confused. And because everyone was so confused and so worried, they put these black box labels onto all the prescribe all the medications. So now whenever I take my HRT and insert, the insert that says all the risks, it will say heart attack, breast cancer, stroke, because they've said it all hormones the same. And they do it over with your FDA as well, and they've never updated it. So that scares women, and it also scares doctors as well who haven't been trained because they think all hormones are the same. But it's not, and it's really important that we know as women. But even if you look at the worst study, like the worst outcome with the highest risk of breast cancer, that risk is still really low. But we've known for decades the benefits for our future health, especially for bones, heart disease as well, but also other inflammatory conditions. And so that's where we need to be thinking in a bigger picture and thinking, well, this is really about choice. We haven't got randomized control studies for natural hormones, and we never will have. We haven't got randomized control studies for thyroxine or for antibiotics. We never will have because we know they work. I would never, as a menopausal woman, go into any study that's randomized, because I tell you what, if I wasn't taking hormones, I would give up my job as a doctor because my brain doesn't work. So I'm not going to risk that. And actually, why would I risk my future health by taking a placebo? But we don't always need to have these big studies. We need common sense. And that's stopped. And what happened since the study came out in 2002, there's been generations of doctors that have not been trained in menopause because they think there's no treatment or the treatment's too risky. So let's ignore it. And then there's other drugs now. There's the antidepressants. There's the heart drugs for the palpitations. There's the osteoporosis treatments. There's all this. And medicine's very siloed. So you see a bone specialist, a heart specialist, a brain specialist, and they don't join the dots and think about, the hormone changes in this poor woman who's suffering.
Is there anyone who you think should absolutely not use HRT?
No. Because, and I say that, this is all very general, of course, because it's about choice. So in medicine, as a physician, I'm there to be an advocate for patients. I'm not a dictator. I'm not there telling people what they should and shouldn't do. So it's like saying, who here should never exercise? Do you know what? I don't think you could ever say to someone, maybe you do, but I don't think you would, you must never, ever exercise. It's up to that person. So say I broke my ankle and I said to you, do you know what, Jordan, I really want to do some star jumps. You'd go, do you know what, you shouldn't do it. And I'll go, no, I want to because my left leg's getting whatever. And I'm going to take that risk. The fracture might be worse. You'll go, okay, but it's not my problem. But I've told you that it might get worse, so it might be painful. And that's the same. The biggest group of women who are told now they absolutely can never have hormones are people who've had breast cancer because of this risk. And because we give estrogen blockers to some women who've had breast cancer. But they block all types of estrogen. So it might not be the estradiol that's the baddie. But what these women are happening is they're losing out on feeling better often, and they're losing out on the health benefits. So for your heart, brain and brains. And the prognosis for breast cancer is so much better than it was. So I see women who've had breast cancer 20 years ago, and they're really fit and well, but they're not, because their brain isn't working. They've given up their job. They're suicidal. They've tried everything else. And they're like, can I just have some hormones because I feel so awful? And I'm saying, well, we haven't got any evidence. It might increase the risk of recurrence, might increase, something happening. Like, do you know what? I don't care. It's up to me. So what do I do then? Go, oh no, speak to the hand. Sorry, can't. That's not for me to do that, but it's for me to explain the uncertainty and potential risks. And everybody's different, and so we will get breast cancer whether we take hormones or not. 1 in 7 of us will, but it doesn't mean that the hormones have caused that breast cancer. And the only other thing that I think is worth mentioning, that these studies that show this maybe increased risk of breast cancer, the women who developed breast cancer on HRT have had a better outcome. So, and that's really important, because it's not just the diagnosis, it's the prognosis, the longer term outcome as well. But it's not just about estrogen or the progesterone, with testosterone as well. And some women find that testosterone improves their symptoms and is more breast friendly, if you like. There is some data that women who have testosterone actually do better for their breast cancer. So that's where it's very individualized, and it should be. Medicine is a bit of an art. It's not just a science, and the art is individualizing care. And that's really important. Every consultation I have is different, because people have different knowledge, they have different expectations, they have different worries. But the other thing is that having hormones is reversible. If I took my patches off now, tomorrow I'll have no hormones in my body. It doesn't build up and build up. So I'm always in control of my hormones. It's not my doctor who comes and puts my patches on twice a week. I do it myself, and I can decide if I want to take them off.
So to your point, you used an interesting analogy, and I really liked it. You said if someone came to me and they said, hey, I want to do star jumps, right? And they've got a fractured ankle.
Yeah.
If someone was like, hey, what do you think? I want to do star jumps. I would be like, listen, I think it's a really fucking bad idea, but like, if you want to do it, go for it. Like, it's up to you.
Yeah.
But I wouldn't recommend it. Is there anyone from an HRT perspective, like, hey, listen, it's your choice, your body, you get to decide. Is there any situation, like, for example, if someone does have breast cancer in their family, or they've had it in the past, would that be something where you'd be like, hey, I don't think you should do it, but you're also welcome to? Or does the evidence lead you to say, listen, there's not enough evidence to show this is going to be dangerous for you. If you want the lifestyle improvements, then I still recommend it. Like, where do you land on that?
So when women have got a family history of breast cancer, absolutely, there's no evidence that HRT is going to do any harm. And a lot of women are told they can't have it for that reason. And that's not true. So there will be an increased risk of breast cancer because of their family history, but not because of taking hormones.
Okay.
So with breast cancer, there are different types. Obviously, there's estrogen receptor negative, positive, and that can make a difference. So generally, people think if the people have had an estrogen receptor negative cancer, HRT is probably safer. But I say probably, we don't have the studies. But even with estrogen receptor positive, we don't know. And before tamoxifen was invented, they used to give high doses of estrogen to women with breast cancer to improve them. So, there's so much we don't know. And that's where sharing uncertainty is really important. We've got quite a few women who've had breast cancer who come to our clinic. We've got data for them for 9 years now. And we've had a couple who, sadly, their disease has worsened. It's impossible to know whether it's related to the hormones or not. But those patients have said, thank you, you've given me the life that I've got better. And I made that choice, and it's really important. And I think that's where, as a doctor, you have to be really confident. And I know everyone's scared of being sued, but I'm more likely to be sued by withdrawing and withholding treatment that could improve their health, actually, if that's what the woman wants. And that's where it's a choice is really important. I think it's not for us as doctors to be able to say yes or no. It is for us as doctors to know the evidence or the lack of evidence and share that with patients. Sure, and that's really important. But it's 2025. It's not 1980 I started medical school in 1988. Well, we never spoke to patients. We just gave them prescriptions. We just told them their disease and here's some drugs and carry on. Whereas now people are more informed. But, as a doctor, I don't tell people that they absolutely can't smoke or they absolutely can't drink alcohol. And I know it's not good for them. I explain to them that they perhaps shouldn't have that lifestyle. But it's a similar thing. And also other medicines have risks. We know there's a risk of osteoporosis with antidepressants. How many people are given antidepressants and told there's
Correct.
this risk? You know what I mean?
Yes,
I've
of
already
course.
said that the prognosis is worse for people who have a fracture from their osteoporosis. So, and I don't know if I'm allowed to talk about sex on your podcast, but I will.
But you can, anything you want, please.
But, like antidepressants are associated with anorgasmia, unable to have an orgasm, reduced libido. So that's with giving that to people, men and women, without really telling them. Whereas people come and see me and it's ruining their relationships, that they've got no libido, that they can't have an orgasm. And do I say, oh, sorry, you can't have this drug that might help? Do you know what I mean? And I think, I'm very fortunate in my clinic. I've got time. As a GP, I had 10-minute appointments. So it's like, oh, let's get everything really quickly. Whereas now I have longer and I get to know patients. And they come because they want to have more specialist advice. But it is advice. And I think that's important for people to know. So when I'm being labelled as controversial, I'm not out there spraying the world with hormones. I'm not putting it in their tap water. I'm just allowing them the opportunity to have a discussion. And so many of them, the first thing they thank us is, you've listened. It's the fact that women aren't believed as well. People who have awful symptoms are just told, well, go and have some herbal tea or do some hypnotherapy or something. It's not enough, is it?
There are many things I respect about you and admire about you, but I think among the greatest is your ability to just give people the information for them to make the decision on their own, which is incredibly important and I think massively overlooked nowadays. And, to your point, women are gaslit like crazy. It's really unbelievable. They're dismissed. They're told that what they're feeling isn't true. They're told not to trust their body. They're told that they can simply change how they feel by acting different or thinking different. It's really.
But you know what? It happens to men too. It happens to everyone. And I don't quite know. And I'm not here to be rude about my colleagues because everyone works really hard. But I was just talking to my mother tonight, actually. And some people might know because I do talk about it. My father died when I was 9. He had a brain tumor. But he first had a brain tumor when I was about 4 or 5. And my mum took him to the doctors and said something's wrong with him. And they said, no, he can't cope because he's just had a promotion at work and you've got 2 young children. So she had to go and see another. This was in the 70s. She had to go and see another doctor and say, no, something's not right. So they said, oh, gosh, no, he's not. And they admitted him to hospital and he had brain surgery the next day. And why do you not believe people? And this is happening. And I understand then it wasn't so easy to get scans and blah, blah, blah. But it's 2025. Every single woman I speak to, or I have so many messages on my Instagram and I do answer them all. But they're I'm just not believed. And even in medicine, I don't have an answer for everything. I absolutely don't. But I've always listened and I've always understood and said, gosh, that sounds awful. Let me see what I can do to help. But I just feel like I don't understand what the advantage is of not listening or, like you say, being gaslit, because it's horrible to think this is all made up in our minds.
I completely agree with you. And I listen, thank God I'm an overall healthy individual, but even with my experiences with doctors, it's been unbelievably difficult to get a doctor to sit down with me and review my blood work or even order the blood work that I wanted sometimes. And I work with a company called Merrick Health, which has helped me do that now, where it's like, listen, I just want to know what's going on with my health. I want to have a sit down conversation with a professional. I don't feel like that should be controversial. Yeah. Anyway, I would like to move on. Do you have a couple more minutes?
Yeah,
Is that
of course.
okay?
Yeah, of course.
Okay. If at any point you're like, hey, I'm done, just let me know.
No, it's fine. It's fine.
So this was another very common question that I got from women who were responding to the question box. They said many women discuss how, despite eating and exercising the same, as they go through menopause, they notice weight and fat gain they've never experienced before, especially in their belly. And I see the phrase "meno belly" all over social media. Um, let's just assume that they're tracking their calories and they're keeping everything the same. Let's take out maybe they're eating more than they
Yeah.
think. Let's assume this person, she is killing it with her nutrition, killing it with her exercise. Is anything happening biologically,
Yeah.
hormonally, that
Yeah.
could make maintaining or losing weight more
Absolutely.
difficult than before?
Yeah, absolutely. And by the way, a lot of people don't eat enough. They're so scared because they're putting on
Mm.
weight. So the menopause with the low hormones is a cardiometabolic problem. So it affects metabolism. So if you remember before, I was saying about the effect in our brain. So our brain determines our metabolism as well. We've got these pathways with our gut, our pathways with our liver as well. So we also know the way that our body responds to insulin and glucose is different when we don't have those hormones. So we're more likely to have insulin resistance. So we're more likely to have these sugar rushes, which can be really detrimental on our metabolism as well. But also, our body is designed to have these hormones. So if we don't have estrogen in our body, especially estradiol, which we really need, our body's like, where do I get it from? What do I do? So it can make it from fat cells, but it doesn't make estradiol. It makes estrone, which is quite an inflammatory type of estrogen. But as you probably know, our fat cells, our adipocytes, they produce all sorts of cytokines and chemicals that we don't really want in our bodies. And it's often in the midline that these fat cells are put down because our body is like, we just need some estrogen. So you've got the metabolic changes that are occurring. So your metabolism isn't going to be the same. You've got this increased insulin resistance. Then you've got more fat put down just because the body's trying to produce estrone from the fat cells. And then if you're like I was, you just can't be bothered to exercise as well. So it's like it's all these things are going against women. But even the women that exercise well, they eat well, they're still going to get changes. And actually, testosterone can have a difference as well because testosterone helps keep muscles strong. So if you haven't got testosterone, a lot of people find their body shape changes as well.
Yes.
They can't have the same muscle tone and the same muscle
Yes.
mass. And you've probably seen that quite a lot.
A lot, a
Yeah,
lot, a lot, a
yeah.
lot.
And that's very disheartening, isn't it, if we're working out and everything else. The other thing is that we have more cortisol, so more stress hormone in our body. And that's often, if you think of like a seesaw, if you don't have right progesterone, you can have more cortisol, and it can sort of, the cortisol can drain the amount of progesterone in the body. So some people who've always done like high intensity exercise find that they're putting on weight by doing that, and that's probably because it's giving you a cortisol surge, which is then affecting your metabolism in a negative way. So I always say to women, let's rebalance your hormones first and wait, because you've got to wait 3 to 6 months before you rush into GLP-1s or doing anything else or changing your diet. And really look at the diet, because many people are so scared to eat that they just don't eat enough or they eat the wrong foods. So it's doing it together really is really important.
I have a theory I want to run by you. I want to hear what you think about this. So, you brought up testosterone and how it obviously helps with muscle strength, muscle size, and as testosterone drops, it's going to be much more difficult to maintain or build muscle. Between that, and we know obviously muscle is highly metabolically active. So between a loss in muscle, you're going to reduce your metabolism there. And this is something that I haven't heard anyone talk about, but this is my theory. With the bone loss, bone is highly metabolically
Of course it is.
active. And so with a loss in muscle and a loss in bone and with that drop in testosterone, to me, it makes a tremendous amount of sense that women who are going through these changes are actually seeing a drop in their metabolic rate, a significant
Yeah.
drop that so their calories might be the same as what they
Yeah.
were before, but now that calorie allotment is essentially too
Yeah.
high, which is why you need to strength train, keep your muscle up,
Yeah.
keep your bone density up. Does that make sense to you?
Absolutely does. And it's interesting actually because there are a lot of women out there who don't take hormones. They might be in their 60s, 70s, and they look great and they feel great, but and this is a generalization, generally people that are really sporty and active. They're runners or they've done a lot of exercise. And I'm sure they've been able to have more hormones in their body as well, because our muscles make estrogen, our muscles make testosterone. Of course they do. It helps. When you've got good muscles working, it helps your mitochondria to work better, so but it's not also going to be quite enough sometimes for your brain and the rest of your body, and so that's where we have to be very individual. But yeah, you're absolutely right. I think people think our muscles are just something we see through our skin, and they just make us move our arms and legs or what have you, and the bones just hold up our body. But they're so metabolically active, and there's so many different things. And, we haven't even talked about any sort of endocrine disruptors, or what happens if you take the contraceptive, which I've already said is synthetic. That's going to have negative effects on all these lovely biological effects that work with normal hormones. So there's lots going on in a woman's body that's just been ignored for too long.
Let me ask you this. What can a woman do before perimenopause to make for an easier and healthier transition as they get older?
You can't. Do you know what?
You can't. I did not expect that answer.
Do you know what? I'm really tired when I hear people on podcasts saying, if women exercise and eat really well, they're going to have a smoother transition. They might, but how do you know what it's going to be like otherwise? And firstly, it's not a transition. The only time menopause stops is when you die, because it's there forever, these low hormones. But there's not two of us unless you've got an identical twin. So I have no idea what my experience would have been like if hadn't exercised, or if I was 2 stone heavier, or what have you. I don't know. But I can tell you, because I've seen thousands of women in my clinic, that I see women who are fit and well, top of their game. They've got no money worries. They've got no career worries. They've got nothing. They're like, the people that you'd love to be. They fall off a cliff. Something happens and they become sectioned. They become dark in their thoughts. And the only thing that's happened is their hormones have changed. Now, you wouldn't predict it. So, I think we're setting women up to fail. What women and men actually need to do is just be armed with information. That's the most important thing that they can do. So, download Balance, look on my website, just get information, because also when it happens to us, a lot of us don't realise it's going on. So you often need someone else to go, do you know what? Like my daughter, why are you so irritable, Mummy? Because it's quite isolating and it's quite hard for many of us when we don't understand what's going on and we think there's something else. But we can't sort of, I think this is a problem when we're saying, oh no, we're better. And it's a bit like people who have postnatal depression. You don't know, you might have the most wonderful and often people do feel great when they're pregnant because they've got really high levels of hormones in their body. And so then they think, oh, it's because it's my baby's fault. It's my whatever. And it's not. It's the way the hormones affect us. So I think we can't be judging people or setting people up to fail. What we all should be doing, whether we're menopausal or not, is thinking about our nutrition, thinking about our exercise, thinking about our future health. That is like, a non-negotiable thing in my mind, really, because But we need to think about it even more when we're menopausal, of course. But that should be happening. But I feel sad, and I feel sad for young girls who are told, oh, well, if you feel bad before your periods, just take time out. It's fine, because it will be better in a few days. That's not good enough either, really.
It's actually a really interesting perspective that I hadn't thought about. So thank you for that. Do you have any tips for male coaches on how we can better serve and speak to our female clients about this?
Yeah, I think you have got you've got the best job for lots of reasons, but you can do it in a very non-judgmental way, because hopefully you haven't got a hidden agenda. You're not going to palm people off with blinking menopause shampoos and face creams and God knows what. You're there to try and make your clients healthy. Sorry. But also you'll be able to watch the person. Sometimes you'll obviously get to know people well, but you'll see physically how they're dropping and changing. So then you can help that light bulb moment to say, look, could any of this be related to your hormones, and make them help, well, not make anyone do anything, but enable them to understand the importance of hormones in their muscles, also their joints, because they're very anti-inflammatory in our joints. So a lot of people have frozen shoulder, they have tennis elbow, they have plantar fasciitis. This is related to hormones often. And it's also often related to low testosterone. So these women will go, no, I've got normal periods. Well, have you ever thought about testosterone? Have you ever had your levels checked? Have you spoken to someone who understands testosterone? And so I think having that awareness when you're, close to somebody and seeing them regularly is really, really important. And often people will open up till, I'm sure you hear lots of secrets that they probably haven't shared with other people. It's a bit like when you see your hairdresser, like you feel that you can tell them anything. And I think it's important.
I see my hairdresser every week.
Yeah. But it's important that we have somebody we can trust and sound off, and somebody who can watch us maybe change, because it can make a huge difference to a lot of people, actually.
Dr.
Not
Newson,
just normalize it. That's the only thing, sorry to add, because so many women go, oh, I've talked about it and my friends are the same and we're just going to get through it together and we're going to have a menopause party and we're going to, what? You don't get a medal for suffering, but think about your future health as well. That's really important.
Dr. Newson, where can people follow you to learn more and to get more of your incredible knowledge? Because there's so much we didn't cover. Where can they follow you?
So the best thing is just my website. So it's drdrlouisenewson.co.uk. And then you can got links to the Balance app, my podcast. I do a weekly YouTube. We're constantly updating, adding more articles, knowledge, and then any live events or things upcoming is on there. And my research, which is a really important area of my work, is the research that we publish in peer-reviewed journal and present at conferences as well. So, and we do some of that collaboratively with other people in UK and abroad. So it's all there. Just have a little rummage, first through the website and see what you can find.
Dr. Newson, you are incredible. I sincerely appreciate you. I admire you. Thank you so much for all of your help and your support and your insight. I encourage everyone to go listen to your podcast, to go follow you and your website. Thank you so much.
Oh, well, thanks. It's been great. I've really enjoyed it.
I'll talk to you soon, okay?
Thank you.